Well, good morning. I'd like to discuss today some of the data that we are using to assess where Pennsylvania is in regards to the fall resurgence of the COVID-19 pandemic. Today we are reporting 1,407 new cases, which brings the total number of COVID-19 cases in Pennsylvania to 195,695. We have now seen 21 days where we have reported more than 1,000 new cases per day of the virus. And this includes 2,219 new cases reported last Friday, the largest one-day total of new cases since the beginning of the pandemic. Over the last week, we have reported 3 days with more than 2,000 cases. Of those cases, 78% are considered recovered, meaning that it has been more than 30 days past the symptoms positive test or onset of symptoms. But as I have discussed previously, we know that the true recovery for many people, sometimes called long haulers, may take months as they continue to deal with chronic symptoms of the virus. Today, we are reporting 1,104 individuals hospitalized due to COVID-19. This number has been steadily climbing and has increased sharply over the last week. For example, last Monday, I reported 841 individuals hospitalized due to COVID-19. A week later, that number has increased by more than 270 hospitalized individuals. We do expect the number of hospitalizations to continue to increase. Hospitalizations normally rise a few weeks after the increase in cases. These numbers, however, continue to be well below what we saw in the spring, where at our peak more than 3,000 people were hospitalized due to COVID-19. But still, these increases are concerning to us. Our healthcare systems are now better prepared to address the virus than they were in the spring. But we must all do our part to prevent a further increase in hospitalizations, particularly as flu season also approaches. Another trend we have seen is an increase in percent positivity, both statewide and in counties. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now at 5% statewide, and that's kind of a crossroads. Last week's percent positivity was 4.2%. In addition, 30 counties now have percent positivities above 5%. Another data point that we are closely monitoring is the number of people who have reported going to a business or a large gathering 14 days prior to the onset of symptoms. It is really very important for people to provide this information to us as part of the case investigation process for our data. We cannot improve our public health response and protect Pennsylvanians if we don't know what puts them at risk. For the week of October 11th through 17th, 71% of people actually did not answer completely questions as to whether they frequented a business or attended a mass gathering 14 days prior to their symptoms. I cannot stress enough how critical this information is and how important it is for people to participate fully in the case investigation process and the contact tracing process. Of those that did respond and answered yes to having visited a business, 55% had reported going to a restaurant. 13% reported going to a bar, 11% to a gym or fitness center, 7.5% to a salon or barbershop, and 26% reported going to some other business establishment. As you know, we now have the COVID Alert PA app, which is assisting us in the contact tracing efforts using Bluetooth technology to determine if someone is exposed to someone who tested positive. The app is really a very important tool to assist in our case investigation and contact tracing process so that we can work to contact all individuals who have been exposed to a case. Now, over the last 2 weeks, we have reported nearly 2,200 new cases of COVID-19 among children that are school-aged, or ages 5 to 18. The percent of cases we are seeing among 13 to 18-year-olds is higher than it was at the beginning of the pandemic. We are also seeing cases spread out among those 50 and younger, compared to our cases being more in those 50 and older during the spring. But at the same time, we are also seeing our cases increasing among those older populations, including those in long-term care living facilities. Within the last week, 24 facilities have reported cases of the virus for the first time. We have reported more than 800 new cases among long-term care facility residents in the last week. As we are seeing these increases among long-term care facilities, it further reinforces how essential the regional response healthcare collaboratives are, also called RICs, as well as the heroic efforts of the Pennsylvania National Guard, both as part of our efforts to protect vulnerable citizens in long-term care living facilities. These partnerships have been working tirelessly to help ensure that residents in long-term care facilities are safe, from assisting with testing, working to prevent spread of cases, and assisting at facilities. This assistance is essential to our response, and we must ensure that we continue to have it as we pass through the fall and into the winter months. So we need an extension of the RIC program because it is scheduled to sunset on December 1st. It might be able to continue somewhat longer if we're able to use some of the funding that had been allocated for the program previously. But then we will need our federal partners to extend the approved term with which we can spend the funding that we have, and also to ensure we have additional CARES Act funding. Additional CARES Act funding is absolutely critical so we can continue to use these programs as essential resources to help long-term care facilities. We also need the federal government and the President to authorize the Title 32 assignment for the Pennsylvania National Guard through the winter and ideally through the end of the pandemic. The Pennsylvania National Guard has been instrumental in the work being done to protect our most vulnerable Pennsylvanians. The other steps that are essential to protecting the residents in the long-term care facilities are actually those that are done every day by all of us together, by every one of us. We know that the number of cases of COVID-19 in nursing homes and other long-term care facilities is directly proportional to the number of cases in the communities and counties where they are located. As we see cases increase in our counties and communities, we see those increases in the long-term care facilities. So each of us has a collective responsibility to protect our families and our communities and to protect those most vulnerable to COVID-19. Despite what has been reported in the last day or so, we can control COVID-19. We can control COVID-19. We need to use all of the public health strategies in our toolbox, starting with containment, moving to targeted mitigation to prevent the spread, and then therapeutics and vaccines that are more tools in our toolbox to control the pandemic. At the Pennsylvania Department of Health and under Governor Wolf's leadership in the administration, we are committed to taking all steps in Pennsylvania to protect public health. We must stand united in this fight to stop the spread of COVID-19. What this pandemic has certainly shown us is that we are all interconnected, and thus we have to work collectively and stand united. We need to mask up, wash up, maintain social distancing, and please download the COVID Alert PA app today. It's free. I know I say these things during each press conference, but I cannot underscore how important they are. We need people to wear a mask properly over their nose and mouth each time they go into public. It is essential that people social distance and avoid large gatherings, and also small gatherings of people, even people who are part of their social circle, because we have seen increasing number of cases linked to small gatherings of people who may even be familiar with each other, but they're not masking, they're not washing their hands, they're not social distancing. And as always, stay calm, stay alert, and stay safe. Thank you. And now I'm pleased to answer your questions. Yes?
Good morning, Dr. Levine.
Hi.
How are you?
Good.
Can you talk about the severity of the cases that we're seeing in hospitalizations? Are they as bad as they were in the spring? Do we anticipate that they will continue to be as dangerous and as bad as we were seeing in this increased surge?
Well, I think the important point to emphasize is that our medical care is much better. So patients are sick, but our care of the patients is much better now because we've learned so much about the virus. For example, approximately 30% of patients who were hospitalized in the spring were on a ventilator. Right now in Pennsylvania, that's about 10.5%, and that's actually less than the national average because we have learned much better who really needs to be on a ventilator and who it would be better actually not to put on a ventilator. We have improved therapeutics and treatment. We have remdesivir, now approved by the FDA. We have dexamethasone, which is a steroid, not a new medicine, been available for decades, but it is used to decrease the inflammation, particularly in the lungs and other parts of the body that the virus can trigger, and using dexamethasone can improve care. We have the potential use of convalescent plasma, which is plasma from patients who have recovered. Hasn't actually been shown yet, demonstrated whether that's effective, but people can use it under an EUA from the FDA, and there are more therapeutics coming. So I think that patients are sick, but our medical care is much better, and that's really good. Yes?
Seth Kaplan from ABC 27. Dr. Levine, just want to ask you quickly about schools. First of all, private schools. We've gotten a few questions from people who wonder, because they don't hear as much about private school cases, whether the same steps are being taken. In other words, is the distinction just between what they disclose publicly vis-a-vis public schools, or do they not take the same steps in terms of contact tracing and all the rest of it? And then I'd follow up with one other quick question.
Sure. So our recommendations for private schools are no different than our recommendations for public schools. And the Department of Education posts those recommendations, I believe, on Mondays, where it depends upon the case counts in the counties where they're located. So those recommendations, now again, it is a local decision by school boards and the superintendent. So it would be a local decision by a private school from their leadership whether they have in-person classes or remote or hybrid or blended type of classes. And we have not seen or demonstrated any difference in the rates in public schools and private schools. And our recommendations would be the same.
And so the disclosure, that's a different question. You know, whether they go out with the information is a different question. But in terms of the recommendation of what to do,
yes,
separate from okay.
That's correct.
And as more school districts go back, I think Lancaster going back today. Just any general thoughts as districts go back, as others prepare to go back, in the context of everything that you just
Sure. Well, I mean, so we have specific recommendations for schools based upon the incidence rate and percent positivity in their counties. And so, again, it's a local decision what they want to do in each school district in regards to their schools. We certainly want school children to wear masks. We want them to wash their hands and use sanitizer. We want them to social distance. We want to avoid large gatherings. So all of those recommendations would continue, and we'll be monitoring those cases.
Thank you.
Any other questions? Yeah.
In response to we can control the virus, you enumerated containment, some of the therapeutics.
Sure.
Do you really think maybe the control is the portion? Are we trying to control the actual virus itself, or our response to it? Is it semantics, or how we react to it?
Well, I think it's important not to give up on our public health responses. There are three ways to deal with a global pandemic, right? You can work to contain it. Working to contain it means expanding testing, and we're continuing to expand testing now with over 34 to 35,000 test results per day. a combination of the PCR tests and the antigen tests. Those that are positive, we contact, do case investigations. They are asked to isolate. The contacts are contacted through the app or contact tracing, and they are asked to quarantine, and that works to contain the spread. The second way is to work to mitigate the spread. Mitigation includes the recommendations regarding schools. It includes the masking and the social distancing and the washing of hands and the avoiding large gatherings. Maybe also, though, avoiding smaller gatherings and making sure that you still take all those precautions. Mitigation includes the limitations on indoor restaurant capacity at 50% that we have, as well as the limitations on indoor and outdoor gatherings. So those are all mitigation steps. And then we have therapeutics, which we discussed, and then we have the development of a vaccine. So Operation Warp Speed is continuing. We don't know exactly when we'll get a vaccine, but we have our planning continuing. We actually today just posted the executive summary of our vaccine plan on our website, so that is available. And so we will be working through all the different phases of the distribution and administration of a vaccine. So we need to use all the tools in our toolbox in order to work to control the spread of COVID-19. We cannot rely upon any strategy that depends upon quote-unquote herd immunity. Really, all public health officials, local officials, state officials, and federal officials do not agree with that strategy. That means basically letting it burn, and that is not a good public health strategy to follow.
You had also mentioned some of the age brackets, so the 5 to 18 are changing, 13 to 18. As we see those younger ages getting infected, but doing a pretty good job of getting to a healthy spot, what do you think about the age that people are getting infected becoming younger and younger?
Well, so as school has been in session and other activities, sports and extracurricular activities, you're going to see community spread into young people. Well, where in the September we saw the biggest increases, dramatic increases in 18 through 24-year-olds, that doesn't stand out right now. I mean, we're seeing increases in young people, we're seeing increases in middle-aged people, and we're seeing increases in seniors. So it's really all segments of the population that are increasing in all regions of Pennsylvania. That's what we're seeing with the fall resurgence. So we have to continue all of the efforts that I just discussed, but it really comes down in the end, and the governor has emphasized this over and over again, to personal responsibility. And I strongly feel that we have a collective responsibility to work towards the common good, to work towards preventing the spread of this virus and protecting ourselves, protecting our families, our communities, and our Commonwealth. And I think that if we all work together, we will be successful.
You mentioned the small gatherings as well. When people are looking forward to the holidays, they're thinking maybe small groups of people that we do feel comfortable with. Should we continue to rethink even small gatherings, Dr.
Yes.
Levine?
Unfortunately, in this time of the global pandemic of COVID-19, as we approach the holidays, we need to rethink those gatherings. We need to think about more and more gatherings being virtual or only staying with your family that you live with, that you're exposed to all the time. And I think that that's a sacrifice, but I think that sacrifice can mean that people don't get sick in your family and in your community, and it would be worth it. So even though that's a really challenging concept, that is what is being recommended by the CDC, and that's what we're recommending as well as people plan for the holidays.
And then is the flu doubling over on COVID, and how are we doing at noticing what is actual regular flu or cold symptoms and what is COVID?
Sure. So the symptoms overlap, and so it's very hard to distinguish between influenza, the flu, and COVID-19. Fever, cough, shortness of breath, congestion, etc. So we have seen some cases of influenza, but not dramatically yet. Now it's only October, and so it's not unusual. But the same measures that people take to control the spread of COVID-19, the masks, the hand washing, the social distancing also will limit the control of the flu. But we have one big current tool in the toolbox for the flu, and that's getting a flu shot. So everybody needs to get a flu shot, either from their physician, their clinic, local pharmacy. You can go to many grocery stores and get a flu shot. It's really, really important to do that. Yes, back there.
On testing, what difference are you seeing with the level of preparedness across the state? And then how many sites do you know of
Sure.
are across the state? And what's more available compared to now from the summertime?
Sure. So our testing has significantly increased over the last number of months from where we were in the spring and even the summer. So our average now is about 34 to 35,000 test results per day, and we want to do even more, but that's going really, really well. We have a very robust testing plan, collaboration between the Department of Health and Michael Huff, the testing director in the governor's office, and we've been able to expand testing. It's a combination of the PCR testing, that's the genetic material testing, which still is the gold standard, but more and more of our tests are also the antigen tests. That's testing for the surface proteins, and there are a number of different ways to have antigen tests done. The newest are the Binax Now Abbott cards. We are getting those cards from the federal government and then distributing them to counties most impacted and to healthcare providers in those counties to make sure that people have access to many different types of tests. They all have different sensitivities and specificities. They have different accuracies, and we have guidance to healthcare professionals about how to interpret those tests. We will be continuing to get the Binax Now antigen cards through the rest of this calendar year. It varies a little bit how many we get per week, but we are shipping those out as we get them, again, to specifically impacted counties. In addition, we continue our robust testing in long-term care facilities, nursing homes, and other congregate care facilities. And there are well over 500 testing locations present in the state. We have pop-up testing with our contractor AMI that goes to different impacted counties and does pop-up testing. And we are working with the Latino Connection to increase testing in the Latinx community. So lots of different ways that we are expanding our testing. In addition, I believe that Director Huff had a press conference this morning about faith-based testing sites in Dauphin County. So again, many different avenues to get tested, a number of different ways that we're doing that testing. Well, thank you very much. I appreciate it.